So, good morning. My name is Iram Bibi. I'm one of the higher trainee in the trust in general adult psychiatry. So I got the opportunity to do this piece of work when I was working in community general liaison team. And it's a department of psychological medicine. So along with the help of my colleague, a senior psychotherapist, and my colleague, higher trainee, Dr. Mushtaq, I completed this piece of work, which is named as Improving Mental Well-Being Through Mindfulness Group Practices. The background, we know that mindfulness is widely recognized as beneficial for improving mental well-being. There's an increased demand for non-pharmacological interventions in mental health. And mindfulness groups offer peer support, emotional regulation, and self-care tools. The objectives of this project were to evaluate changes in participants' familiarity with mindfulness practices, to assess improvements in stress, emotional well-being, and confidence, to identify barriers and challenges during therapy, to get feedback for service improvement, and to assess sustainability of benefits after a period of input, like we did it after 1 month. So basically, in the beginning, how we collected the patients, number of patients. Obviously, as I mentioned, that working in the community liaison, we have many other colleagues like nurses, specialist therapists, and consultant psychiatrists. So we requested them to refer those patients which they think they need mindfulness exercises. And then we individually interviewed each of the participants. Initially, we got more than 10, like 10 to 15 patients for that. And then we gave them an individual appointment to come. It was not a formal one. We just discussed how, like there was no input criteria. It was just to see whether they are happy to go ahead with this mindfulness group. This will be a number of other patients as well, and how will we run it, and we also did one mindfulness exercise at that initial interview individually. And at the end, there were 8 people who agreed for the group, but however, by the start date, there were only 6 individuals who participated in this mindfulness group. What we did is that we booked a room in Pearson Park for 3 hours every week, same time, and we gave this address to the patients. They were coming there, and we were doing every week a different exercise, mindfulness exercise, after discussing like general discussion. We also tried to make that place relaxing for that. So we had tea, coffee, and all little bit snacks for them as well. The other way of giving them some reading stuff in between the sessions for a week. The facilitators were also recording mindfulness exercises for them to listen at night for better sleep. So, and there was the exercises like walking in the park. Mindfulness walking was another exercise done. So data was collected before the start of therapy, after completion of therapy, and 1 month after the completion of therapy. So as I mentioned, it was an anonymous self-reported survey administered at 3 points. And the focus of the survey was familiarity with mindfulness group, reasons for participation, stress level, presence in the moment, emotional overwhelm, confidence in practicing mindfulness independently, participation in home practice challenges, expectations and satisfaction, overall well-being rating, and feedback on valuable experiences or challenges or any suggestions. I tried to put the survey, to see what kind of questions were there. So as I mentioned, there were before, after the therapy and after 1 month of therapy. There were many questions which were just for before the starting of therapy, and some were after finishing the therapy. So it was only relevant questions were asked to be filled. The questions were like familiarity with mindfulness practices. So there were some options like I didn't find any change. I was already familiar, somewhat familiar, practiced mindfulness occasionally. I have gained some understanding of mindfulness. I feel confident starting a mindfulness practice. I now have an established mindfulness routine. So similarly, other questions were main reasons for participating in this mindfulness group, current stress levels, how often they feel present in the moment, how often they feel overwhelmed by their thoughts or emotions, how confident they feel about practicing mindfulness on their own when they are not in the groups, and asking them whether they took part in daily challenges at home practice in between the groups, and their expectations, whether we met their expectations, exceeded expectations, partially met or did not, and their overall well-being, obviously before starting, after finishing, and after 1 month finishing. So how did we measure? As I mentioned, this is so familiarity with mindfulness practices, self-rated stress and emotional overwhelm, confidence, presence in the moment, overall well-being rating, and feedback, open-ended questions. So results were like 100% participants moved from inconsistent practice to established mindfulness routine. 100% confidence increased steadily from baseline to post-therapy and sustained at 1 month. 100% results were greater independence in mindfulness practices. Stress level showed marked decrease from baseline to post-therapy. 5 out of 6 people said that their stress level is reduced. 5 out of 6 said that they were benefits, they got benefits even after not doing exercise for 1 month after finishing the group. And there was shift in presence from rarely to sometimes to often and almost always feeling present. So results were wonderful. There was decrease in feelings of emotional overwhelm immediately after therapy. There was slight variability at 1 month, but overall improvement from baseline for everybody. Well-being scores improved. Fewer participants rated themselves in low ranges, and it was only 1%, 1 to 2%. Positive themes of this group: peer support and group interaction highly valued when they've asked about the open-ended questions. Mindfulness tools and structured practices were appreciated. Participants reported improved mood, presence, and self-care. Most would recommend this program to others. We have some challenges as well. So anxiety about group sharing and extended speaking. And we all know that there are different backgrounds, different natures of people. So some found it very helpful to open about extended and sharing about themselves. Some were very reserved. So there were difficulties with mindfulness walking exercise because not everybody was in a good state of physical health. Technical issues accessing home practice recordings. As I mentioned earlier, we were sending some recordings as well, so some of them were not able to open those recordings. One participant did not enjoy sessions at all, but continued attendance. So proposed actions. So introduce smaller breakout groups or pair work to reduce anxiety. Offer alternative exercises for participants struggling with walking practices. Improve technical support and instructions, set clear group guidelines to balance openness and comfort, and collect continuous feedback to monitor engagement and satisfaction. So implementation strategies are facilitators to support anxious participants separately. Develop varied mindfulness practices to suit participant needs. Provide easy to use guides for digital tools. Collaboratively establish group norms in initial sessions, so everybody should be clear, and schedule periodic check-ins or booster sessions post-therapy. So conclusion is that mindfulness intervention showed improvements in stress, confidence, and well-being. Benefits sustained at 1 month follow-up. This was what I recorded the data for. Feedback highlights value of program and areas for refinement. So next step should be like refine delivery, strengthen group support, and enhance technical facilitation. So yeah, thank you very much.